So now we're going to hear the physician perspective, and for that, we will be hearing from Dr. Linda Hong, who's a GYN oncologist at Loma Linda University Medical Center in Loma Linda, California.
Hi, I wanted to thank the Let Every Woman Know organization and committee for inviting me to speak here at the 11th Annual Arts of Gynecologic Cancer Awareness and Arts of Healing Weekend. My name is Linda Hong, and I am a gynecologic oncologist at Loma Linda University School of Medicine. Today, I am going to speak to you about my experience with social media and the impact of social media used by physicians on gynecologic cancer treatment and survivorship. I have nothing to disclose. Just wanted to do some background here. The term social media was first introduced around 2004 and is defined as a form of electronic communication. More specifically, they are websites for social networking and blogging through which users can create online communities to share information, ideas, personal message, and other content. And this is taken from our ACOG committee opinion. So just to highlight how massive social media has become, I wanted to just share some social media usage data. According to Brian Dean on his article on social media usage and growth statistics, this was taken in 2021, projected for 2022. It is estimated that 4.5 billion people currently use social media worldwide, which is more than double from the 2 billion people using social media back in 2015. The average social media user engages with about 6.6 various social media platforms. And then 99% access websites or apps through a mobile device, with a little over 1% accessing platforms exclusively via a desktop. 72.3% of the total US population actively use social media. This totals to about 240 million people, I'm sorry. In the US, 54% of social media users are female, while the remaining 46% are male. This is opposite to the global average, which is 45.6% for female users and 54.4% for male users. There are so many different social network platforms that are available to everyone. And with every platform, there's a set of different purposes, some highlights to each. This table was actually taken from Social Media Superpowers in Obstetrics and Gynecology by Good and Tanaway, and it highlights some of the strengths and weaknesses for each platform. Of course, we're all familiar with Facebook here, and it's the most popular platform used. About 2.7 billion users engage in it every month. Highlights include the ease of use and the ability to create communities. It's limited in the ability to gain a large reach when compared to its counterparts. Other platforms such as YouTube can be quite time consuming to make and those videos and share, but there is a potential for financial gain. There's a lot of different sponsors. And then you can use that platform to educate the public on whatever topic. Another time-consuming social media platform that has gained very exponential growth is TikTok, which can gain large reach quickly. These are younger users, and one of the things is that it can really spread like viral, rapid fire. Some other platforms such as LinkedIn focus on career-driven professional networking, and not necessarily for like patient connection or education. Traditionally, the use of social media among physician community was in personal capacity, sharing personal life events, experiences, and thoughts, and we all do this. Recently, physicians have started using social network platforms in a professional capacity. Some physicians use social media platforms to share health education with the general public, as with each other. They create professional and patient communities, as well as some market their practices and themselves as a social figure. In 2016, a review by Rolls et al. On health professionals used social media to create virtual communities. The most common web-based activity was requests for and supply of specialty-specific clinical information. They conclude that healthcare professionals view virtual communities as valuable knowledge portals for sourcing clinically relevant quality information, and that enables them to make more informed practice decisions. Now, I understand this study was a bit ago. Currently, it's thought that up to 90% of physicians engage in social media. And if you look at the different social media platforms, there's a lot of different physicians that we are very familiar with that have become kind of influencers of physicians. As we all know, gynecology oncology is a unique gynecologic subspecialty that requires expertise in both surgical and medical treatment of gynecologic malignancies. It requires an up-to-date management of the latest therapies for gynecologic cancers. In addition, competency in radical pelvic surgery, bladder and bowel surgeries, and upper abdominal procedures is quite standard. Given a broad expertise in medicine and surgery, I often have asked myself, where do we fit into the medical community? Is our community with their obstetrics and gynecology colleagues? Is it with the medical oncology folks or surgical oncology, just to name the different types? For me, I think it's pretty easy to say that I think we can say our best community is with each other. With this thought, I decided to venture on creating a group for gynecologic oncologists. Because of the specialization and uniqueness of the field, being a gynecologic oncologist can be lonely and isolating. Some thoughts here. During fellowship, it all starts where a majority of us were in programs where only one gynecologic oncology fellow was accepted per year. Social media has closed the gap to help us connect with each other. And according to a blog with one of the members, SGO Blog Voices, being a fellow in the era of Facebook, written by Erin Stevens back in 2013, she was able to continue her connections to other gynecologic oncology fellows through Facebook, and social media helped her celebrate as well as commiserate in real time with other fellows across the country. I think this was kind of the start of us connecting to each other. In practice, gynecologic oncology, even from fellowship, you may be the only one and only in a group of few, or you may be the only one in the region or the state. You may also be the only gynecologic oncology practicing in multiple state borders. According to the Society of Gynecologic Oncology State of Society survey back in 2020, there were only a total of 1,126 gynecologic oncologists in the United States. Just 1,126. For me, I have been a part of multiple Facebook physician communities, including moms groups, various surgeon groups, obstetrical and gynecology groups, as well as physician groups specialized for gardening, home decor, travel, side gigs, etc. There are multiple challenges and commodities specific to our field, like any other field that other physicians will simply not understand or know. A gynecology oncology community would help create a safe space to address some of our concern challenges and just commiserate together. In August 2017, I started the Women of Gynecology Oncology group on Facebook. It was a spin-off idea from a physician's moms group who now have over like 120,000 followers and members. Once I started the group, I immediately started adding friends to the group who also invited their friends. I was set on the group being only gynecologic oncologists and gynecologic oncology fellows, and everyone was checked and verified for credibility before accepting into the group. My goal was that it would be a casual group of gynecologic oncology friends, at the space to vent as well as learn and connect with each other. Interestingly, the group started as a mom's group and evolved to women, as members felt that it was too isolating and members would feel left out given our small specialized society. just what does a Facebook group look like? It can actually track data on your group and show various statistics. It's very interesting. Don't look at it very often, but when I do, it's just summarizes some of the data for me. I took a snapshot of the month for us to kind of view, and it's from last month. As of December 21st, 2022, there were a total of 555 members in our group. The majority of members were 35 to 44 years old. The second most common bracket was 45 to 55 years old, and our overall age ranged between early 30s, I'm assuming fellows, and then up to 65 years plus. Members were all verified women gynecologic oncologists or gynecologic oncology fellow in training. Members were mostly residing in the US. About 23 were located in Canada, and there were some other members in other different countries as well. Top 3 cities of members residing were New York with 34 members, Houston, Texas with 15 members, and Los Angeles, California with 15 members. During the period of November 23rd to 22 to December 21st, 22, there were 464 active members, which is about 84% of the total members. From member engagement, there were 63 posts, 332 comments to the post, and about 762 reactions. Now, I don't have any other groups to compare to this to, but I do have engagement in some other smaller groups, and that seems pretty active. The group trends, the most popular day for a gynecologic oncology member on Facebook group was Saturday. The most popular times for the WGO were between the hours of 12 and 6 p.m. So what does a group like us post about? In the last 5.5 years, posts that have consistently come up have really fallen into the 7 major categories. The first and foremost is patient management. We all want to discuss patients and try to improve our patient care, discussing scenarios and management of patients with complex cases. Both chemotherapy and surgical discussions and some rare diseases come up quite a bit. Job opportunities, posting real-time job openings in their practice or another practice, trying to connect members to jobs if they're searching. One of the categories that I probably would have not predicted was that patient relocation. A lot of times there are patients that we have that are either temporarily residing in another state or permanently moving to a new city. And this has helped members try to connect with other members in other locations to help assist the patient find a gynecologic oncologist there. The next category that has been big for the group is that connecting and collaborating on research projects, using the platform to remind members to complete research surveys that go out through the SGO membership, and even utilizing the WGO members as a target for a survey on research topics. And I had the pleasure of actually running that survey research through the members to find some inequalities that we face. Another topic is board study groups. So finding members taking tests and formulating study groups or partners, finding members to do mock orals with has been pretty important. And I also want to say that the life support posts have been very big on our group. Anything from congratulating on milestones, promotions, publications, celebrating each other's birthdays has been very helpful. Information sharing. I think I really commend some of our group members who are in GOG and have lots of research out there. They sharing new trials and studies, and then meetings and meeting informations that come through, protocols at one's hospital that is shared. Those are all very beneficial to all members, and I think I really have appreciated these over the years. So what does a social media community thrive, or what makes a social media community thrive? What has been shown to work for us? I think first and foremost, knowing the target audience, us, and what I expected from the post connections and engagements. rules to hold on to, who can become members and what type of posts are acceptable. I think we don't have very many rules, but the one rule that do resonate with me is that it's important that we keep it gynecologic oncology only. I know there's been questions previously of support staff or different members such as medical oncology or surgical oncology that deals with a lot of gynecologic oncology, but what really holds true is that we connect with each other. Another thing is time investment. In order to continue to be an active and relevant group, time must be spent checking on the group, and continuing engagement is important. Making information sharing easy and accessible. One of our moderators shares a group Google Drive with members, and I think we have like a collection of slides for sharing literature, board review information, PowerPoint presentations that members can, use. Why has this all been successful? I think because we have answered questions in real time. High proportions of members are online on the platform, ready to help and be a resource for each other. Our current professional societies are excellent and informative, but can be very formal and sometimes intimidating to recent graduates, and sometimes a lot of us who are already graduate a while. Online resources such as Tumor Board are great, but concerns and questions are never addressed in real time. I think that's what really helps these social media platforms. So what has been the impact of social media used by physicians on gynecologic cancer treatment and survivorship? For me, it has been to help develop a community. There's knowledge sharing, a space to connect with colleagues, build networks, and grow friendships, ultimately benefit us and our patients and how we treat them. According to Ponce et al. On Netiquette for social media engagement for oncology professionals, private groups for physicians or healthcare professional, often organized by specialty, location, or other interests, can offer a space to connect with colleagues, develop networks, and grow friendships. These can be both professionally rewarding through opportunities for collaboration, speaking engagements, and mentorships, as well as personally satisfying by creating connections with other physicians. I think these are very true and kind of really was what I was looking for. In addition, these semi-private spaces can connect physicians who feel geographically or philosophically isolated and can provide space for discussions and problem solving with others who may have similar experiences. And in my experience, for me, WGO has been truly an affinity group. Affinity groups are organizations that create spaces for those who do not otherwise feel like they have space or have limited space. And I think the conversations centered around our group have been shaped by our experiences as gynecologic oncologists and our similarities in working with other professionals. These groups help not only allow us to bring our complete authentic selves, but offer support to challenge experiences and set goals that address our unique needs. It can also be used as a platform to address common inequalities and bring attention to issues that might rise within our community. There's always a lot of topic or debate of things that we always address day to day. And I've been blessed to meet amazing people. And these are some pictures from meetings, different SGO meetings from 2018, I think 2019, and probably prior to the COVID era. Social media does have its downfalls. There is no true online anonymity, and there's really not a true online private groups. We must maintain patient confidentiality because that's very important as well, and then adhere to our institutional guidelines on social media. According to Wang et al. In Social Media and Oncology, the good, the bad, and the ugly, online anonymity is an illusion. The technology exists to identify users, and private Facebook groups can be infiltrated. As the lines blur between private and professional personas online, we must ensure to stay professional. Although discussing cases and peers online can be useful research, confidentiality should never be compromised. And so we try to adhere to this confidentiality and try to not really have specifics about patients. And social media can be very time consuming. I don't know if any of you watched the new Wednesday show on Netflix. She said, I found social media to be a soul sucking void of meaningless affirmation. Sometimes it does suck the time constraints and can waste time. But I think it also in a pit is helps us to connect with each other and can help us help take care of patients. With that, thank you very much for listening.